Imagine waking up after surgery and realizing the operation changed your life forever. Not because the surgeon made a mistake, not because something went wrong in the operating room, but because you never truly needed the procedure in the first place. Every year, millions of people trust the words, "Don't worry, this is routine." Routine knee surgery, routine abdominal procedure, routine cesarean, routine cosmetic correction. But here's the uncomfortable truth most people never hear. Some operations are recommended long before every safer option has been explored. And once the cutting starts, your body never completely forgets it. Scar tissue forms, nerves react, muscles compensate, organs shift. Sometimes the problem disappears. Sometimes a new one quietly begins. I'm going to walk you through 5 procedures that deserve far more caution than most patients are given. Not fear, not conspiracy, just honesty. And by the end of this video, you'll know the single question every person should ask before agreeing to any surgery, because one rushed decision can follow you for decades. It usually starts with pain nobody can fully explain. A woman has abdominal discomfort, bloating, pelvic pressure, maybe fatigue. The scans are unclear. Then comes the sentence that sounds harmless. We'll do a diagnostic laparoscopy. Tiny incisions, small camera, quick recovery. That's how it's presented. But very few people understand what actually happens inside the body. First, the abdomen is punctured with surgical instruments. Then, carbon dioxide gas is pumped into the abdominal cavity to physically expand it from the inside. Your organs are literally pushed apart to create viewing space. The diaphragm gets compressed upward. Breathing mechanics change. The body is tilted into unnatural positions for surgical access. And afterward, many patients are told everything went perfectly. Yet weeks later, they feel strange pressure, tightness, pulling sensations, pain that didn't exist before. Why? Because tissue injury doesn't need a major complication to leave consequences. Every incision heals with scar formation. Every internal irritation can create adhesions, bands of tissue that can restrict natural movement between organs. And here's the frustrating part. Sometimes the procedure discovers absolutely nothing urgent. Now, to be fair, there are situations where laparoscopy is life-saving. Emergency bleeding, suspected organ damage, severe unexplained conditions. But in many non-emergency cases, modern imaging can already provide enormous information. Ultrasound, MRI, CT scans, advanced blood testing. A careful doctor uses surgery as a last diagnostic step, not the first shortcut. And that leads directly into the next operation, one that thousands of parents panic over every year. A parent notices a soft bulge near a child's belly button. They rush to a clinic. The word hernia is mentioned, and suddenly fear takes over. Because the moment people hear the word hernia, they imagine organs bursting through the body. So many families agree to surgery immediately. But what most don't realize is this. Umbilical hernias in children are extremely common, and many close naturally as the body develops. The abdominal wall strengthens over time, connective tissue matures, the opening gradually seals on its own. Yet surgery is often discussed long before the body has been given enough time to heal itself naturally. Now, there are dangerous situations. A trapped hernia can become a medical emergency. Loss of blood supply to tissue is serious. But those cases are not the majority. And this is where medicine becomes tricky, because fear makes people impatient. Parents hear, "What if something happens?" And emotionally, they want certainty immediately. But surgery always have a cost. Anesthesia, scarring, postoperative pain, potential complications. So instead of asking only, "How fast can we fix this?" people should also ask, "What happens if we wait carefully and monitor it?" That question alone can completely change the conversation. And there's another overlooked truth here. Weakness in the abdominal wall is often connected to overall muscle support and connective tissue strength, which means the body itself can sometimes improve stability naturally with proper movement, posture, breathing mechanics, and strengthening exercises. Not every bulge automatically demands a scalpel, but the next routine procedure might shock you even more, because most people don't even think of it as surgery. People hear the word operation and imagine operating rooms, bright lights, masks, scalpels. But technically, every injection pierces living tissue, and repeated injections can leave lasting effects people rarely discuss.
Think about what happens during an intramuscular shot. The needle cuts through skin, fat tissue, muscle fibers. Then fluid is forced into tissue under pressure. Once, usually manageable, but repeated injections over months or years, that changes tissue quality. Some patients develop hardened areas deep inside the muscle. Others experience chronic soreness or inflammatory reactions. Oil-based injections are especially notorious for causing prolonged irritation because the substance stays trapped in tissue longer. And in rare cases, abscesses, nerve irritation, serious infection. There's one nerve in particular doctors are extremely careful to avoid: the sciatic nerve. If damaged, it can affect sensation and movement through the entire leg.
Now, listen carefully. This does not mean injections are bad. Some are absolutely necessary: emergency medications, critical antibiotics, life-saving treatments. But the problem begins when injections are treated like they are automatically stronger or better than oral medication. Modern tablets and capsules are incredibly effective in many situations. Yet in some clinics, patients are still pushed toward repeated injections simply because it feels more dramatic, more powerful, more medical. And many people never ask whether a non-invasive option could work just as well. That same obsession with appearance over long-term function also fuels the next procedure on this list, and this one has become a billion-dollar industry. A facelift promises something deeply emotional: time reversal, the possibility of looking younger, refreshed, restored. And for a moment after surgery, many people do look tighter and smoother. But the human face is not just skin stretched over bone. It's a living network of muscles, fascia, nerves, blood vessels, and expressions connected to your entire posture and emotional identity. Every smile, every frown, every raised eyebrow, all of it depends on delicate balance. When surgeons reposition facial tissue, they're changing that balance. And sometimes the body adapts beautifully. Sometimes it doesn't. People begin noticing subtle asymmetry, an unnatural pull around the mouth, tension in the neck, a face that looks done instead of alive. And then there's the hidden irony nobody advertises. Scar tissue can reduce circulation quality in the very tissue you're trying to rejuvenate, which means years later, some areas may actually age faster. But here's what fascinates me most. Many people chasing cosmetic surgery aren't actually suffering from old age. They're suffering from exhaustion, poor sleep, stress, inflammation, lack of movement, tight neck muscles, reduced circulation. The face reflects the body. Improve blood flow, reduce chronic tension, move daily, sleep deeply. And suddenly the face changes naturally, not frozen, not stretched, just healthier. Because genuine vitality looks different from artificial tightness. And now we arrive at the final operation, the one that can save lives, but is increasingly treated like convenience. Let's make something absolutely clear first. Cesarean sections save lives. When complications arise, when the baby is in distress, when natural delivery becomes dangerous, a C-section can be the difference between life and death. That is modern medicine at its best. But over time, something changed. In many places, cesareans became normalized far beyond emergencies, scheduled for convenience, scheduled for fear, scheduled just in case. And people often underestimate what a C-section truly is. It is major abdominal surgery. Multiple tissue layers are opened. The uterus is surgically incised. Recovery can take weeks, and the body remembers that scar permanently. Future pregnancies may carry added risks because of it. Meanwhile, natural labor triggers powerful biological processes that surgery bypasses entirely. Hormonal cascades, lung compression that helps newborn breathing, transfer of beneficial maternal bacteria during birth. Scientists are still studying the long-term effects of these differences, but evidence continues to grow that birth method can influence early immune development. Again, this is not about judging mothers. Not at all. Sometimes cesareans are unquestionably necessary. The issue is whether every recommendation is truly based on medical need, or whether fear and convenience are quietly driving the decision. Because once again, the real danger is rushing. And that brings us to the most important part of this entire video. Before agreeing to any elective procedure, ask this: what happens if I wait? Not emotionally, medically. What changes in 3 months, 6 months, 1 year? Can physical therapy help first? Weight loss? Movement? Nutrition? Monitoring? And if the answers feel vague, get another opinion. Then another. Good doctors do not fear second opinions. In fact, the best ones encourage them. Because medicine should never begin with cutting if healing can happen another way. Surgery has an important place in healthcare.
But unnecessary surgery leaves marks people carry for years, sometimes physically, sometimes emotionally, sometimes financially. Your body is not a machine part that can simply be replaced without consequence. And the older we get, the more every scar matters. So protect your future carefully. Question calmly, research deeply, decide slowly. Because the best surgery in the world might be the one you never needed at all. If this video made you rethink how modern medicine works, subscribe now. And in the next video, I'm exposing the everyday health habits quietly destroying circulation after age 50, including one mistake millions of people make every morning without realizing it. Watch that next. Your body will thank you.